Good afternoon, and welcome back to Spirituality LearnFest. We are delighted to have you on for this, our first live session of the afternoon. I have the pleasure of introducing and moderating our first session of the day. We are beginning with a palliative care discussion titled Expanding Horizons. My name is David Eisenmenger, and I am the Director of Education, Research, and Programming for the Spirituality Pillar. And I'm very proud to introduce the rest of our panelists today. If I may introduce Kathy Owens, our Chief Nursing Officer, who is here with us today. Stephen Stocksdale, the Vice Chairman of Business Development. And also joining us virtually, we have Brad Nobles, who is the CEO of Signature Healthcare at the Courtyard. Additionally, we have Ketha Hunter, who is the Director of Nursing at Signature Healthcare at the Courtyard as well. So a very warm welcome to each of our panelists. Thank you for being here with us today.
Thanks for having us.
Thank you. Thank you. I wanted to begin to provide just a little bit of context. As you may be aware, we have initiated development of a palliative care program of distinction. And our goal here is to develop a service line of palliative care that will be at the program of distinction level throughout the organization. We want to raise the standard, so to speak, in terms of how we are delivering palliative care across the company. This really has been a dream for us for several years. For a long time, we've wanted to be able to offer a very strong palliative care line of service. And so today, this panel of experts will give you the opportunity to learn some of what we've been working on and to share with you some of how we envision things to go for the future. So let me begin my first question with Kathy Owens. Kathy, if you would, just tell us a little bit why palliative care and why is this important to us here at Signature?
Well, it's a great question, and I want to, first of all, thank you for including me in on this panel. And I think one of my first responses in terms of why palliative care is for a few reasons. First, it's we at Signature really want, to borrow from my friend Stephen here, we at Signature really want our residents to be able to enjoy every aspect of their life throughout their life. And having a mental mode and an emotional mode of palliation allows us the opportunity to be able to support our residents in that way, which I think is like such a fabulous opportunity. We're already providing palliative care in some form or fashion every day in our facilities, and we actually do recognize that, and in many cases do a phenomenal job with that. Some of our partners, such as the Brad and Ketha from Courtyard, they have actually been pursuing this dream and are teaching us even more about how to raise the bar around palliation. So I first want to recognize that this isn't something new. This is already happening, but we at Signature want to recognize that a large portion of our population actually need us to be highly skilled in this area. It's absolutely critical for us to understand how to help people become comfortable, help people be able to reconcile within themselves any concerns they may have, spiritually or personally, that will allow them that opportunity to enjoy life through their very last days. And I can't think of anything that's a stronger dream of mine, and I'm so excited to be a part of Signature, for it to be such an important emphasis at Signature. So why is this important to Signature? First of all, I think Signature is the ideal location to be able to bring this to the forefront, and in large part because we have such a strong spirituality pillar. Clinically, palliation is all about symptom management and, like pain, nausea, vomiting, constipation, diarrhea, some of the things that go with long-term chronic disease or terminal illness, or the treatment of such things. That's typically what you will find in terms of the clinical skill sets. But usually the discussion always blends into a discussion around the spiritual element and the spiritual experience that people have, not just the resident and the family, but also the caregivers who are caring for those residents and family members. So I cannot think of a better organization to put this in the forefront. So for the reason that we have a large population who we really feel like will benefit from this emphasis, we also have the tools and the support of an organization to be able to take this and broaden it out from just a clinical focus to a real spiritual and emotional focus.
Indeed, indeed. Well, this program really, since its inception, has been a strong marriage between clinical and spirituality, bringing our best strengths in both of those disciplines, in both of those areas to the forefront. And so this, as the program develops, just an opportunity to see a further full expression of that. So,
great.
Yeah.
Great. Very exciting.
Yeah. Good. Well, as we begin to think about palliative care and what that means to bring it to our organization, one thing that we may want to clarify really kind of early on is kind of the distinction between palliative care and hospice. And so, Stephen, I wonder if you could speak to that for just a minute for us.
Certainly, Dave. Good afternoon, everyone. Let's talk a little bit about the difference between what hospice is and what palliative care is. Hospice is an idea. It's not a place. Hospice care can happen in many different venues. Hospice care is supportive, and it's usually given in the final phases of a terminal illness. Its goal is to provide comfort, freedom from pain, and unfortunately, a lot of us will have the experience when we have a loved one has an incurable illness, treatment doesn't work any longer. We can still provide comfort. Even if we may not be able to prolong their life, we can still provide comfort. On the other side, palliative care is a medical specialty. It focuses on aggressive symptom management, and it also focuses on the prevention and the relief of suffering. That's palliative care. We seek interventions that look at your physical needs, your psychological needs, and your spiritual needs. That's what we look for. We look for not only the resident, we also look to the family. We have an interdisciplinary team approach to this. You remember that palliative care affirms life. Remember those words, palliative care affirms life. We try to integrate the psychological and social needs of a person, and we really seek to enhance their quality of life. Palliative care is provided throughout the continuum of care. It's not end-of-life care, it's your whole experience with us. Palliative care is for anyone that has a serious condition. We want to improve their quality of life. And it's regardless of their prognosis or their diagnosis. But it's an intervention. We seek to relieve suffering. Palliative care happens throughout the course of care, just not the end of care. So we hope to see that and get that mindset. But palliative care is to affirm life and affirm your experience with us.
Mm-hmm. Very good. So thinking not just kind of in terms of the hospice frame, the last 6 months of life,
right.
But thinking further along and not just offering hospice experiences, not just offering hospice interventions earlier, but really affirming life earlier on in the disease process throughout the longer period of time when you're with us.
Yes, regardless of your diagnosis or your prognosis, this is an approach we have throughout the entire time you're with us.
Stephen, I just love how you emphasize the word affirming, because it really is, it really captures the positive nature of this approach.
Yes.
And you say it with such passion, so I appreciate that.
Good, very good. Well, you maybe, so we've talked a little bit about palliative care, kind of how we understand it, how we kind of frame it in our minds conceptually. Let me tell you a little bit about the pilot program that we have initiated. Again, as a very strong partnership between clinical and spirituality, we've initiated an operational pilot that is cross-segment and is currently operational in 4 centers throughout our company. We have Cherokee Park, Harriman Care and Rehab, Signature Healthcare at the Courtyard, and also Signature Healthcare of Muncie in Muncie, Indiana. And the pilot process has been excellent so far. We've had the opportunity to introduce some of our interventions or approaches, but then we've also had the opportunity to learn a lot from our palliative teams who are trying these things out in the field initially. So
Yes, some tremendous dialogue. It's just been awesome.
Yes. So right now, with our teams, we have currently 3 groups that are working on strengthening our pilot in the areas specifically of the training that we offer, as well as the assessments that we are using in order to establish our admission criteria, track progress through the program, and these assessments will become really the basis of our outcome measures that we use as we are looking at the program in the next phase. Additionally, we have a team that is helping us to strengthen the role of the program champion within each center. So. And I must say, too, this effort at piloting a program, we really do stand on the shoulders of others historically. There were some such as Dr. Stone, Jeff Beatty, Carol Harrison, and others who were on the team that were doing an initial program launch around 2008. But now is the time. Now we have the competencies and capabilities that we need throughout the organization. We're the right size. And this is the right time to do it. And so blending the strengths of a variety of our resources together, and with excellent support from Dianne and the rest of the spirituality pillar, now is the time. So let's give you the opportunity to hear from some of the folks who are actually involved in the pilot. Our next question is for Brad, our CEO at the Courtyard. Brad, I wanted to ask, how has the pilot been received in your home so far?
Stated earlier, we've kind of had a palliative care program here, but, with the enhancement and everything that we've been talking about with this new program and us being in the pilot, our staff are really receptive to the program and everything that is involved with it. We are planning a learning congress for our staff so that we can get all the education done at one time with them, so that everyone will be on the same page and that we'll know the in and outs of the program and what our expectations are. And we're just really looking forward to having that learning congress and enjoying the time with the staff and education and getting the program fully functional and started.
Very good, very good, very good. Well, we greatly appreciate the work that you all have been doing. We know that as we look at centers throughout the company that already have a lot of bench strength in terms of palliative care and are already delivering quite a bit of doing already quite a lot to provide palliative care already. We know that that including your team in here has been an excellent choice, and we appreciate your co-leadership and your guidance in this pilot process. So, Ketha, if I could, let me just ask, what impact do you really foresee this program that'll have on the patient care in your home as it continues to roll out?
Well, again, thank you for having us on your panel discussion today. I foresee it having a positive impact on patient care within our facility. Like Brad had already said, we already had the palliative care type program going in our facility, because we do inform palliative care on all of our patients. But being able to have a formalized palliative care program will allow us to enhance the quality of care that we provide to our residents, allowing us to take a more holistic care approach when providing care for them. As the holistic care is defined as being able to provide, nursing that is a healing process of the person as a whole. And by having that palliative care program within our community, we're able to provide this service to our community, and it will enhance our patient care. Being able to include the spirituality piece, within the program, that was a huge difference. We're from a small rural area, and a lot of people see healthcare as not being able to carry on your faith beliefs, and being able to have that spirituality piece included in our program will allow us to promote that more. That pillar, within the company. So I feel like it will allow us to be able to provide better continuity of care, better quality of care, by being able to focus more on the patient and their individual, status versus focusing on the diagnosis itself, but being able to care for them better as a whole.
Very good. So, from your comments there, I see the strong emphasis that you place on being able to continue to emphasize healing. And healing can be different from cure, can't it? There can be a real, some qualitative difference there. But from the standpoint of being able to offer healing that happens within a holistic context, and that having a community impact is very significant, I believe. Mm-hmm. Any follow-up for Ketha?
Yeah. The holistic aspect of it is very important. To be able to provide the education, that additional education program provides to our staff to be able to better care for our residents by providing that holistic care approach. I've been doing this for a while, and it kind of takes you back to where you're caring for the patient and not just the diagnosis. You're able to see them as a whole, and in general, that will always provide, better quality of care for our elders and within, our community.
Excellent points. And I actually want to publicly acknowledge the work that you've already been doing. I think my understanding from our conversations that you've been engaged in this process for several years, 5 or 6 years, and are actually further down the path of formalizing a process. And we're actually learning from you about what you're doing every day, the palliative care carts that you've created, the environments that you create as people move through into those final stages, has been really quite the model to emulate. And I think because the efforts that you've created and put into play, all of us at Signature are going to benefit from that. And I want to personally thank you for the work that you've done.
Well, Kathy, we have framed this up really as a clinical program of distinction, mm-hmm. and so what are some of the aspects that we're bringing to the program design that really do kind of fulfill that program of distinction moniker, so to speak?
Well, that's an excellent point, because as we talked about earlier, we provide palliative care, and you don't necessarily need a program of distinction to be able to provide palliative care. But what we wanted to do was to frame it up and provide some kind of structure around it so that we could make sure that we are providing a certain standard of practice around palliation. What makes a program of distinction different than a service that we provide on a routine basis is we've actually, David and then Myrna in the past as well, have really worked hard to look at what the evidence-based assessment instruments are that are available out in the scientific community, and what makes this program distinguished, I believe, is that we're going to be looking at evidence-based assessments as well as interventions. We pulled in our Serenity partners to be able to integrate the the concepts around caring for the cognitively impaired at this time of life. So many of our residents who actually will benefit from an enhanced palliation or palliative care program of distinction actually have cognitive impairments. Plus, as people move through different phases of their of illness, they have the illness can have a cognitive impact. So we really felt like we wanted to integrate some of the great things that Serenity has done into this model, so that will help arm our stakeholders to be able to better work with these individuals and find out what gives them a sense of personal success and enjoyment. So the evidence-based assessment, bringing in Serenity, I think is going to be very important. The other pieces that we're doing is the education component. We're actually, I think it's going to be a really fun, you were talking about the Learning Congress, there's a very specific e-curriculum. We're learning with our pilot, teasing out what's going to be an e-curriculum focus that you can do online versus what elements need to be experiential and face-to-face. And so that's what's going to also make this a different process. We also are putting a heavy emphasis, and tell me if hopefully you all will agree with me on this. We're putting a heavy emphasis on the caregiver and helping the caregiver go internal, do some self-reflection, get a sense of where the caregiver is with the cycle of life, and help the caregiver be able to work through their thought process, their mental mode, their emotional mode, so we can, in concert, I love that word, affirm the resident's place in life and joys in life, and really help be a partner, a true partner to the resident and the family as they go through this process of the cycle. I call it the cycle of life, and this very important transition. That's another piece I think that does distinguish what we're going to be doing. Another component with this, in terms of the education component, is we are very aware that with this palliative approach, it does bring up the conversation around advanced directives. And that conversation is takes some skill to be able to enter into that kind of dialogue. And it requires an ability to have that meaningful dialogue with the resident and their family members. And so we are going to be spending more time and investment looking at how does that conversation look, what skills do people need, doing some role-playing around having that conversation, and educating our stakeholders and caregiver teams about the legal components of that, and it's an all-encompassing component. And in typical care, the reality of the world we live in, there is not usually as a defined time dedicated to that conversation or a defined exploration of that unless there's already a good connection between the stakeholder and the resident and their family. So we're putting a heavy emphasis on that piece. What also makes this a program of distinction is the clinical piece definitely, and the competencies, the skill sets on assessing the need for symptom management is very much important, and making sure we're at a standard of practice that is the best standard of practice in this area. But that partnership between clinical and spiritual, I can't tell you, that's, to me, is a defining component yet again, and that's why it's so exciting, and this is such a perfect fit for Signature, is with our chaplains being with us every day, and with our residents every day, that gives us a depth to this process that I don't think everyone in our space in healthcare can share. And then finally, I think the other piece with the program of distinction component has to do with the fact we're going to be measuring. We're going to be measuring numbers of people that are entering into our palliative care process, the types of quality outcomes that they're having, as well as we, quite frankly, and this is going to show my bias with this, I feel really strongly that this has a real business case for us. And it's not that, the real reason we're doing it, of course, is to meet the spiritual, emotional, and physical needs of our residents. But there's a business case for why we should do this. You know, this is a large population, and we need to do it the best. And we feel like that it will help us be able to assess the needs of our resident more appropriately, provide more clinically appropriate support, and capture that documentation in a much more holistic manner to frame Ketha's comments. And I think that there's more that we can do and more opportunity. This actually intersects with the PHQ-9 project because there's such an assessment of the mood component, the anxiety component, and that will feed into having a more accurate assessment of the resident, more accurate coding on the MDS, hopefully more accurate capture of our ADL process, and then we are so about comfort. And I really want to make a plug for our signature rehab colleagues here as well, because there is a Part B opportunity here. And our rehab colleagues are well educated in not just functional improvement, they're educated in functional maintenance. They're also educated in the use of modalities. And modalities do play a big role in helping us address the symptom management of our residents. So I think that there's several places that come into play here from a business case. And so now that we're capturing this as a program of distinction, we're going to be able to have real solid material, granular outcome measures that speak to clinical, speak to spiritual, speak to psychosocial, and speak to the business component as well.
And I think we can add to that too. You know, if we look at the future of post-acute admissions, palliative care will be one of those primary populations. You know, of the three reasons for admission, palliative care really will be in that top three. One of the things that, as we're looking at the projections for how admission patterns will be changing in the near future, people, when they come to post-acute, will be looking for palliative care. That'll be very high on their list.
You know, I want to add to the other value of doing this process, David, I think, is it has forced us to capture this in a framework.
Indeed.
And then what it also has helped us do is work with Peggy King and the agency to be able to pull together a weight for materials, collaterals, to help our facilities communicate to the communities the value proposition that the facility has in a palliative care program of distinction. It really does have some, you're right, it's one of the three major populations that we will be working with going forward, and the great tsunami's only starting. So, so we have to be armed to be able to manage this, but we have to do it better. And we also recognize that. We're doing it okay, but we just have to do it better, and we have to do it with the sincerity and genuineness that is going to be so important and so much a connection with our residents and families. So.
Great. Well, we're seeing just a lot of opportunity for the program, just, you know, from the clinical side, from the business development side. Stephen, I wonder if you could speak to that in a little more detail.
We do see a few opportunities here for us. We know that we'll, excuse me, we know that we'll actually be able to enhance our expertise when it comes to understanding and responding to the spiritual and cultural needs of our residents, and also in how we develop resident and family support systems. We'll get better and better at that through this experience, and through time we'll also be able to develop perhaps some unique interventions that go across the care continuum, go across the life cycle they spend with us. And we already participate in the individual care plans, and we always seek, excuse me, to improve the resident and family experience. But this gives us an opportunity to combine the curative side and the comfort care measures for the resident and also the family, because as Kathy mentioned earlier, what we really want is for everyone to experience what Signature has to offer. And when Kathy was mentioning the business aspects of this, we have looked at those aspects, and there is opportunity there also for the company. It does the program distinction that will attract attention, the actual involvement with the residents and the systems we put in place actually do have a benefit in our other programs in the company. So as we looked on the business side of this, there was some opportunities, and there are some opportunities for us. So we look at this as a positive on both the care, resident, family side, and also in our business too.
Great, very good, very good. So we've kind of looked at it a little bit globally. I'm very curious to check in with our team in Courtyard. Brad, as you and Ketha are thinking about the future opportunities that this program will bring and the impact that it can have on your community, what is some of your thinking around that in your community in Mariana?
Well, because we are a small town, word of mouth, of course, travels the fastest, and I believe once we get everything going here at the Courtyard, the community will hear from other families that have been involved with our program here, and I just really feel like it's going to be one that once the word gets out that that they will look to for that extra care and those extra things that we're able to do in this program. So, I think that it will be a draw to those families and a draw for them to want to bring their loved one here so that they could, experience what we have to offer and, have the best quality of life for their family member in their disease process, no matter what it may be. And to be something that we can show that, hey, we know what we're doing when it comes to palliative care.
I think I can remember working in one of our rural homes, and at that time, the home was the second largest employer in the county. And so from that standpoint, all the things that we did to impact the quality of life for our stakeholders really did have a significant impact on the community. So if you look just at the opportunity for the ripple effect, just from the standpoint of what this brings to your stakeholders, as Kathy has said, in terms of having folks to work through their own kind of individual spiritual process, so to speak, and to really kind of embrace and the life-affirming aspects of palliative care and to integrate that into who they are. They carry that with them out into the community. And so for that to begin, that light being shown, so to speak, to begin to impact the community at large, and for folks to know that if there is a need that you have with serious illness, even at end of life, that our communities, our homes, our centers are the place where we will care for you the best. And as you said, Brad, that impact comes out exponentially in the community, especially in a close-knit community. So.
David, that does bring to mind a comment that I've heard even more recently with some of just my own personal experiences that I think I'm really excited to see, based on just exactly that you said, Brad. So many people say that when they've had their loved one in a location and that loved one has passed, that one of the moments, it's so anticlimactic and somewhat off-putting to get the loved one's last effects in a bag, and with like no ceremony, and it's just sort of like here's the loved one's items. And I know that that's a fairly common practice. One of the things I'm so excited about with our program of distinction is, in addition to the life-affirming component, is that component to carry through to the into the actual bereavement phase, and to, in a respectful way, be able to package up we're looking at how do we resource our facilities who want to be a program of distinction. How do we give them the tools to be able to package up those last effects?
Indeed.
Personal effects, because that is a message, and it leaves a different feeling depending on how that is managed at the facility with the caregivers and the family members who then take that message out to the community. We're also looking, what's going to make us different, I forgot to mention this, is that we are going to be supporting our own caregivers in their bereavement process and working with our residents as they move through this transition, this very, very significant spiritual transition. They will have an opportunity to work through their own feelings around that and have their own rituals around this that are so important. And that actually not doing that well enough, I think, contributes to burnout in our caregivers.
I agree.
And it contributes to a decline in sensitivity because people begin to shield themselves to the experience and the connection. So we're hoping through this palliative program of distinction, we will engender that level of empathy and sensitivity and allow our caregivers the opportunity to celebrate and affirm the lives of the residents as they pass.
Yeah, indeed.
It's so important.
Yeah. Through as we look at the 3 pillars and the influence that brings in, really one of the underlying messages is bring your whole self, bring all of who you are to your care. We see that clearly in the spirituality pillar. With the learning pillar, we don't want to hold, we want to say we don't want you held back at all. We want you to achieve your personal best, whatever you can. With our innovation pillar, if you have a good idea, we want to know about it. And so from that standpoint, maybe kind of taking what is somewhat of the old school approach, so to speak, saying that as a resident passes, we must maintain our professional fortitude, but then to say, yes, of course, be professional, but we're going to make it okay for you to be your whole self, even in those moments as well. So
yeah, it's very important.
Indeed.
Very important.
Great. Very good. Wanted to take the opportunity to highlight maybe a couple of features of the program that we haven't had the opportunity to emphasize. Many of these that we have touched on already, but one or two important things is to emphasize vigil. This will be significant as well. And so what our emphasis here is that when we have situations of residents or patients who are at end of life, being very intentional to say that no one passes alone, no one transitions alone, that we are there providing for the family or for our stakeholders, making sure that there's someone at vigil at the bedside with someone continuously.
Excellent point.
Indeed. We also want to continue to drive the patient-centered aspect of what we're doing by making sure that we include Simply Me as part of our standard interventions as well. Simply Me comes from our partners in Serenity, and what this is a tool that provides us the opportunity to, in a very snapshot way, have a good shorthand understanding of the things that are most important to a resident, so that as care is being delivered, just by glancing at a beautiful framed item over the bed, they know some of the most critical things that they need to know about that patient in order to treat them in the midst of serious illness. So.
Also supports the interventions with the cognitively impaired, so in personalizing care. So
indeed,
absolutely, that Simply Me is awesome.
Good. Very good. Well, Ketha, I wonder, are there additional, from the clinical standpoint, what impact do you see having this on your clinical team, on your clinical care overall? I know that we've kind of talked about things from kind of the community perspective, but for your team, what impacts do you see?
I feel like the program will have, huge impact, positive impact on long-term care, within our facility. As Kathy had said earlier, just basically going back to the basics, and you're able to provide this care for your elders that you've had for a long time. One of the things with having hospice come into your facility is that they provide these services, but we're able to provide the same service by providing the palliative care program, and we're able to continue that continuity of care by having our own chaplain, as hospice brings in their chaplain, their support worker, and the residents are more familiar with our people in-house than they are with the outside entity. Not that I have anything against hospice, and it's always the resident's choice, but I think that it's a positive to be able to provide that service to our residents that we've taken care of all this time. And unlike hospice, we're able to provide life prolonging interventions that the resident may want, instead of with hospice not being able to provide that type of service. I feel like in addition, the palliative care program has the new it's provided us with additional tools such as pain management, where we have like guidelines that will help us as nurses and the whole clinical team with being able to provide some type of algorithm to go over with the doctors and being able to manage their care and manage their pain. I feel like it'll help tremendously with QMs and being able to put a better focus on certain areas in relation to providing care to our residents. I feel like one of the biggest parts that I'm excited about is being able to look at dementia, residents that may be in the end stage dementia, and being able to put them on a type of palliative care program, because sometimes we do forget that end stage dementia is a terminal diagnosis, and we're able to enhance their quality of life by putting them on a program, because it provides more focus on their individual needs, and we're able to make life better for them. And a majority of the time, it is our long-term residents that are the end stage dementia residents that we're able to assist by placing them on this palliative care program. The educational piece of the program is astronomical. By being able to do the Learning Congress, we're able to educate based on the Serenity module. As Kathy had said earlier, we're not a Serenity building, so we didn't have access to a lot of the dementia training that the Serenity buildings have, but being able to provide the Serenity piece by having the palliative care program is huge. Being able to educate our staff members on how to better care for our elders with dementia. The palliative care program has provided us with that opportunity to have that education available to them. So, from a clinical aspect, in relation to the long-term effect and the long-term care, I feel like the palliative care program is going to, be a huge addition to what we've already been doing, and it will have a huge impact on our community and being able to provide this service. It's a service that other facilities in our area do not offer. Although we've been providing a palliative care program, by being able to do it under the new guidelines and this model, it provides better clarity. We have additional tools that have been provided through the palliative care kit that allow us to do better, thorough, comprehensive assessments to determine who is appropriate, for the program. Like I said, the education, if it allows us to better educate, ourselves, as well as our staff on how to better care, for our elders. And the advanced directive piece, by incorporating the Interact tools along with the palliative care program, it allows us to do, more in-depth advanced care planning. We're able to use those Interact tools with explaining end-of-life care, to the patients. So I feel the program will allow us to provide better care for our elders, and it will help us connect more with our families that we've come to love as family members ourselves, and it shows the community and the family members that we do care, truly care for their loved ones, because we're able to provide that go that additional mile and take that extra step to provide that end-of-life care for their loved ones.
Very well said. Very well said.
Thank you.
As we begin to close, we want to give you the opportunity to ask your questions of any or all of the panelists. And so we'll be putting an email address up for you to email your questions in. And while we're waiting for those to come in, just want to turn to our panelists and ask for any closing comments from each of you.
Yeah.
Yeah.
First, I'd like to say thank you for sharing today with us, and we really look forward to having the opportunity to speak with you about palliative care and the importance of it and how it would be so impactful for our residents and families. And again, thank you for sharing these moments with us today.
I think for my closing comments, I have a couple. Hard to believe.
Just a few.
I want to actually thank Ketha and Brad for joining us today again, because once again, I'm so respectful of the work that you're doing and your real life experience with this, and once again, you and the other members of our pilots, like Muncie, the team at Muncie has been very, very involved as well, and you all are actually paving the way for everyone to do it as well as you're currently doing it. So while I know you're in the pilot, you're actually also a primary leader in this, and you've really captured a lot of the essence of where we're going and are going to help all of us get there. So thank you for that. That's absolutely critical. And this has just been such a great opportunity. I want to thank everyone who's been listening, because this is a commercial for what's coming. So we're really excited to be able to raise the bar on this and move forward. So it's going to be fun.
Indeed.
Very fun.
Thank you. Well, indeed, this has been a dream that has come to fruition and is developing, having the opportunity for us to roll out this initiative company-wide and to really raise the bar across the company for the services that we provide. In all of our segments, in our skilled nursing centers, as well as in the home environment, that's part of our vision as well, being able to offer this type of care comprehensively. So, very good. All right, so one more check on questions. Great, very good. All right. Well, wonderful. Well, I want to thank each and every one of our panelists for joining us today. Thank you also, Brad and Ketha, for taking your time there out of your busy schedules.
On a busy Friday.
At a very busy Friday. That's right. That's right. Very good. Great. Well, thank you to each one of you for watching today. We greatly appreciate your time and your attention. Thank you.